Okay, can you hear me now? All right, I think I muted myself and I forgot to unmute myself. So let's start again. I am so sorry about that. Trying new technical things. Okay. So can you hear me now before I start talking again? All right, I think we have some yeses here. Okay, so sorry about that. I was waiting for my timer and I hit mute and then it must have not unmuted. I thought I muted. So sorry to waste your couple minutes there with me going on and on. Anyway, welcome. I am Dr. Mary Barbera. I am doing Facebook Lives about autism every Monday at 1 p.m. Eastern Time. And I am thrilled that you're here. I started doing these Facebook Lives every week at the same time to try to help both parents and professionals struggling in the autism world. And I started right before the COVID shutdown. So sometimes I have more prepared topics and sometimes it's more Q&A. I'm also trying an additional technical challenge this time by adding my paid members of my online courses and communities to a Zoom call so that they can also ask questions. So what I plan to do today is I asked my paid members, what struggles have you been having since the COVID shutdown? And I'm going to be covering the struggles and also giving some tips, pointers, strategies that I think would be good for both parents and professionals, because a lot of us are struggling financially in all kinds of ways. But then we add autism on top of it, and that is a lot of times really hard. Okay. So for those of you that don't know me, I fell into the autism world in the late 1990s when my firstborn son, Lucas, was diagnosed with autism one day before his third birthday. I actually fell into the autism world before that when Lucas started showing signs, but my husband first picked it up and he mentioned the word autism. I shut him down. I was horrified. I told him I never wanted to hear the word autism again. And meanwhile, we wasted a lot of time because of my denial. So I went on to become a board certified behavior analyst. I am a best-selling author of The Verbal Behavior Approach. I'm also writing a second book that will be out in April, all about how to help young kids, 1 to 5-year-olds with autism or signs of autism. And that is through parent intervention. I've created step-by-step easy systems for parents to learn how to become the captain of the ship. I have a Turn Autism Around podcast that comes out every Tuesday. Tomorrow, I have a really special interview with Kate from Finding Cooper's Voice. That's going to air tomorrow. So if you haven't checked out my podcast, you can go to marybarbera.com/podcast. You can subscribe and you can listen to that podcast interview tomorrow. That's going to come out. Every week, I also produce a weekly video blog that helps both parents and professionals. So as promised, I am going to discuss some of the struggles. And if you have a question that is related to the struggles you are currently facing, whether you're a parent or professional, let us know in the comments. I have a couple pages of notes here that I actually asked the members, both parents and professionals, from my toddler group and from my Autism ABA help group, and got a lot of the same themes. So I'm going to cover those, and then I'm going to cover some strategies to help us get through this, because I'm in Pennsylvania, in many parts of the United States, we are still pretty much shut down still requiring masks, still everything's closed except for grocery stores and a few other essential services. So, yeah, it's been a real struggle. So let me get through the responses from the members, and then we'll talk about strategies, and you can chime in. I also have some helpers in the group who can, if I give you a link, they might be able to jot it down. So, okay. So I have, like I said, 2 different groups, one for very young kids, mostly parents in there, and some early intervention professionals. And then I have a bigger group with professionals and parents that are either graduated from the toddler course or have older kids, and that's when they started with me. So in both of the groups, we have over 500 people, I believe. So pretty good, pretty good population. So I asked, since the shutdown, what is your biggest autism struggle, or in the toddler group, what is your struggle with your child or clients diagnosed with autism or showing signs? Because half of our members in the toddler preschooler group do not have a diagnosis for their child yet. They are waiting, they are worrying, and they are trying their best to teach their child to talk, to calm down their tantrums, to sleep in their own bed through the night, to wean from bottles and pacifiers. You name it, they are struggling. And so I asked them all this question. I got 38 responses in total, 15 from the toddlers and 23 from the other group. And pretty much the number one issue, which is kind of like all combined, is it's very, very hard to engage your child all day long with the lack of routine, with the sudden abruptness of no more school, no more school bus, no more OT, no more speech therapy, no more swimming lessons, no more playground swimming lessons, whatever. No more karate, no more social skills group, no more music therapy, no more special needs yoga, you name it. And as a parent, I know that even though my son is an adult now, he usually goes to an adult pre-vocational program every day for 6 hours a day. That is obviously stopped. Many people are reporting that their services have come to a complete halt or been reduced or went from physical help to now online, which for many parents is just not that helpful. So that is kind of all rolled into one. It's trying to engage your child. Now, the other factors that are making it really difficult for parents to engage the child with autism or signs of autism is they are either working from home. One or both parents are now suddenly working from home. Their child's not going to daycare or preschool or therapies or whatever. And now you're supposed to be working, and now you have a very impaired child that you're trying to keep engaged. Then the other big factor that was reported by a lot of people is multiple siblings of varying ages that need different things from you. One mom who is a mom of 4 with 2 kids on the spectrum, a 2-year-old and a 12-year-old on the spectrum, and 4 kids in total. She said, basically, there's not enough of me to go around. So that is the big crux of what is happening with families. Also, the professionals that did weigh in on their struggles, they are trying to work too with their kids at home and going to telehealth with either very young children through early intervention services, for instance, or with older kids with moderate to severe autism is very difficult because you can't you can't sit a 12-year-old with moderate to severe autism in front of a computer and have quality therapy happening without a parent or caregiver or therapist sitting with that child. There's just, in my experience, there's just no way. And some of the professionals within our One group are reporting that they are now expected to do like language for learning with kindergarten through second graders with moderate severe autism. That is really, really tricky. So that the telehealth is becoming, in some cases, unless you are not working from home, unless you have a young child and you are used to, or an older child and you are used to homeschooling and used to 24/7 care and teaching, a lot of times that telehealth can be just another task for you to have to sit for a half an hour or an hour and monitor and try to work with your child. Another issue is that there's more and more screen time. Just this one family reported that her and her husband were both working full-time from home, and then they had this child on the spectrum, and he was basically getting 3 hours of screen time in the morning while they were diving into deep to their work, and too much screen time. I am not like a real I'm not really against all screen time like a lot of professionals are. In fact, I did do a video blog way back on screen time and how I think in doses and if you can figure out how to use that motivation to do short clips, and we could actually use it, and we do use it within my online courses to promote speech. But we have to use screen time to our advantage, and large amounts of screen time are leading to increased scripting, increased stimming. Parents are then feeling guilty, anxious, worried about regression. Their children are showing regression in some situations with increased OCD and anxiety and scripting. There might be new and worsening sleep issues because there's really not much to get up for. And then if you get them up and you got to do work, so it's like a catch-22. It can really impact their sleep. And in a couple of cases, the moms, mostly moms in my groups, were reporting that they felt a lot of pressure because they were the only source of learning and therapy, and this was a lot. Okay. We do have some additional concerns and some positives, and then I'm going to go into some of the strategies. I'm just going to look in the Q&A boxes and see, or the comment section, and see what kind of questions. All right. So somebody said in our country, the UK, the government was going to discriminate against people with autism if hospitals were overwhelmed. It's made me have second thoughts about having a diagnosis for my son. Yeah, I did hear that, if they became like a triage situation, I know some states in the United States passed legislation so that that wouldn't happen. That is a really scary thought. It's a scary thought because there's a lot of people in hospitals that can't have visitors. But if you have a child or an adult with a disability who needs a caregiver, you can be there for that child. But you can't, I've heard this from a few acquaintances, is that, say you have a 12-year-old with autism and that 12-year-old for whatever reason needs to go in the hospital. One parent can go in. So say I went in with my 12-year-old and then I said, okay, I have to stay overnight because he needs somebody all the time. And then if I wanted my husband to come in and relieve me so I could go home, that was like a no-go. So then you were basically trapped for as long as the child needed to be in the hospital. So whether it's a child or somebody with a disability, there are exceptions for that in most hospitals. Somebody says, my 4-year-old has autism. I've been dealing with new situations with him, smearing and grabbing poop. How do I deal with this? He's never done this before. So that is a severe problem, and it's not like something I can just solve right here on a Q&A call, but I would check a couple things. I don't know if he's toilet trained, but if he's not, you may want to really work on that. I do have a free potty guide at marybarbera.com/potty. Also, you may want to check with your physician if this is a new problem. It could be, constipation, diarrhea, it could be some gut issues. It could be mineral or vitamin deficiencies. It's just like there's a host of issues. And it needs an analysis, especially this is a new issue for a 4-year-old. So download the potty guide and seek out medical attention from your pediatrician. I struggle with small obsessive behaviors like writing 5 instead of 2, and the more correct it, the more it gets reinforced. We're going to talk a little bit about OCD. A lot of kids, especially when they are not having the structure that they've had at school and not having the activities to keep them busy. You have one of two problems. You either have like this really defective language starting to happen, obsessiveness, and asking questions that they know the answer to, scripting from movies, just really nonsense language, or you have, more extreme behaviors where they might be having aggression or self-injurious behavior, or like that woman reported about smearing feces. And there's just a host of things that can happen when the child is suddenly has no routine, has limited engagement. And so I would say you just need to learn more about how to engage your child. One way to do that, to learn more about my systems, is to take my quiz, my free quiz, marybarbera.com/quiz. I think I have a little thingy here I can put up on the screen. Let's see. Yes, I do. So, oops, that's not right. All right. Well, it is marybarbera.com/quiz is the right link for that. This is /join is a 3-step guide. So that's also a good free resource. And then, of course, just marybarbera.com will take you to my website where you can look around and see many of my resources there. Okay, so, excuse me. All right, how to effectively potty train a 3-year-old who's nonverbal and autistic. In the 3-step guide, which I just talked about, I talk about how, if you have a nonverbal child who is 3 and not potty trained, but he's also not taking his socks off or pulling his pants down independently or washing his hands, that a lot of times potty training actually needs to be put on the back burner and you need to work on other skills. So I would say, really consider joining my online course and community, and that's really where I can help you best. Okay, let me look and see. And any suggestions on how to teach my child with autism to say mama. So I have a shoebox here. So one of the best ways that one of the many strategies I teach is, and I have a shoebox program video with a cheat sheet of how to do this, but basically get a box, you cut a slit into it. I like a box that has a lid that's attached, and you get a picture of mommy. So you can get other pictures too, not just mommy, but if you really want them to say mommy, you also want to teach them, probably if they have a father involved, daddy. if they have siblings, Johnny, if they have a dog named Spot. You want to get pictures of one person on each picture. This is a picture of a tent, but you get the idea. So this would be mommy. I would have the shoebox on the table. I would say mommy, 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 and have the child put the picture of mommy in the box. It's not going to solve all your problems, but that is one way that we begin to pair for past 2 years, but trying to research her splinter skills. So I do have a video blog on hyperlexia. If she's fully conversational, my courses really probably won't be appropriate, but this is a all-encompassing, when you have a child with autism with splintered skills, this is about going back and doing an assessment, a plan, working on the right things, because the more you reinforce the splinter skills, the worse she's going to do. Okay, let me get back before I take any more questions with the results from my question to my members asking about COVID. And I want to give you some strategies for how to increase engagement and also for getting some kind of routine in place. In addition to all the things I mentioned a few minutes ago, the lack of routine and engagement and parent guilt, the toddler group also, because in my toddler group, I basically show you how to get a shoebox, inset puzzles, potato head, and I show you videos of exactly what you should do, table and chairs, and just some of those basic materials that some of you may have laying around. Some of you may need to order some things online or go to a store. And there was some additional comments that stores were closed and where this person lived throughout the world. We have people from over 80 countries who have taken my online course. So wherever this woman was located, they didn't even have online ordering and delivery. So she was having trouble getting some of the materials. And then a couple of the toddler parents also reported that the long waiting list to get an autism evaluation were just getting longer. Their appointments were being pushed off, canceled. If they were, some of them were turned into virtual appointments, and they didn't really feel like that was good enough to give the diagnosis. A couple people in both groups reported that the shutdown, they were using the shutdown and they actually had some positives. Even though I was asking for struggles, they said it's actually been a positive for them in terms of dealing with autism. One member reported, this is more positive rather than a struggle. Before the pandemic, we used to rely on speech and occupational therapists for our son's therapy. My wife and I had no time, and we didn't know how to teach our son at home. But the toddler preschooler program for me is a blessing, because now we know how to help our son in all aspects. We also have all the time in the world to teach him now. So they have found it to be positives. Even people in my older group have reported, like, I'm so happy I did your courses. Now I know how to teach my child and I'm empowered. One woman actually said, I also feel empowered after your course and advice to manage my son 24/7 at home. Some members are using this time to potty train or watch the course lessons or start teaching talking or getting tantrums under control, or they're working on sleep. Now sleep and potty, both of those, I'm have some expertise in both potty training and sleeping. And a couple of the things for potty and sleep is pick a good time when, you're going to be home a lot, where you don't have to go to a conference or to make it a routine so that you can work on the nightly routine and it's always the same. So some members are actually using this time to improve. Some adults with and without autism are trying to use this time to learn a new skill, like learn to play the piano or learn to, find ways to lose weight or to exercise more. One of my members said, she keeps reminding herself to look at the forest, not the trees. And I say that a lot. Like, it's not just about solving this one big or little thing. It's about looking at the whole picture. And if you have a 6-year-old or a 2-year-old, looking, okay, what's the immediate problem? And then looking at the whole child going forward. So we do have a new quiz, marybarbera.com/quiz for both parents and professionals, toddlers routines with signs of autism, with autism. And that can really help you, lead you to the right workshop where you can find out more about what to do, how to avoid common mistakes that I see all the time. So some of the ways I would recommend you work on engaging and routine is, one of the good things is if you have an iPhone or a smartphone. I'm more familiar with an iPhone, but there is a reminder app on your phone that you can actually set up. And if the child has an iPhone or an iPad, you can set it up on their device where you actually schedule out the day. You can schedule with yourself, or you can have the child. It can be set up, and this is free. This is attached to all iPhones, and I'm sure with Androids and with other devices on iPads, you can set it up. And to set up the reminder app, if you don't know how to do it, I would just Google on YouTube how to set up reminder app. Figure out how to make a basic schedule. If you don't want to go that high tech, just take a piece of paper and draw out, literally, like if for lunch you're going to have pizza, you could put lunch and you could put a circle and put pizza. The child doesn't, just needs to know, like, first we're going to have breakfast, then we're going to play outside, then we're going to do learning time at the table with, some of the early learner materials like the shoebox. Then we're going to, whatever. It might really help. Maybe you can schedule in iPad time or screen time. Children with autism have very poor leisure skills. So them just having an abundance of free time to do, who knows what, can be, first, it can be a dangerous situation, and then it can be really a problem with just stimming and scripting and getting perseverative and that sorts of things. So reminder app, setting a schedule, trying to stick to it, trying to at least engage your child at a table for 15-minute sessions a few days a week. But you don't want to just do this willy-nilly. I've told you, I produce free content. I produce, video blogs, the podcast with Kate from Finding Cooper's Voice is coming on the podcast tomorrow. There's so much free content, but that's the problem with autism. There's so much free content, and you don't want to just get a shoebox and then let your child carry around the shoebox and start stimming with it, because it won't be a learning activity then. It'll become a STEM activity, and it won't really do what it's intended, which is to increase language. Okay, let me go back here and see what kind of questions I have. Okay. How do I get a child to write with a pencil? 5-year-old, first of all, I would say a 5-year-old, okay, it's probably important, but can they scribble with crayons, which is really a prerequisite. This join guide is a 3-step guide I created. We just recently revised it. It's a 3-step guide, and that allows you to do a 1-page assessment. So if you say it's a 5-year-old with autism, I want him to use a pencil, my questions are, does he talk? Does he comprehend? Is he potty trained? Is he safe? Can he wash his hands? Can he answer questions? Can he sing songs? How is his problem behaviors? The worst thing you can do is just skip to holding a pencil when all of those toddler skills are not in place. You certainly don't want to give a child with 5-year-old child, a sharp pencil or a pair of scissors, which I've seen, if they can't even handle, if they don't even like crayons, they don't like, I mean, he could stab himself or somebody if he has problem behaviors. So my thought is, don't just jump to trying to work on pencil or trying to work on math or reading. We really need to work on language, self-care, and reducing problem behaviors so that your child is happy, that you are less stressed. We need to work on leisure skills. We need to work on all kinds of things, and that may definitely come first. Okay, sign language or saying it to get what he needs. And somebody's saying they use PECs. So I'm a behavior analyst. I've worked in the field for 20 years. And I am all about whatever language abilities we can get. If your child is using an augmentative device or they're using pictures to communicate and that's going well, and they are religiously using it and it's going great and you have no problems, that's one thing. But most of the time when I've seen kids in the past, it's been they have something, device, or they're using a little bit of language, spoken language. Nobody's working on articulation. One of the problems I see with devices and picture systems is that there's a very big push early on to get carrier phrases, which I am very opposed to. I did a video blog on carrier phrases and why you should avoid them. So anything that gets, like, if the child says pretzel, but the articulation isn't good, which for pretzel, that's hard because it's a blend. There's all kinds of syllables in there that, or word blends that are later developing, but they might say pretzel like bata, and then you go and you add I want, and that sounds like and then everybody's like, oh, we have to put them on a device. And my philosophy in my online courses, I'm very big on working with a speech pathologist, working within the verbal behavior approach where everything is broken down and language is taught as a behavior, and we start with one syllable sounds, and we start really getting things, building the blocks. So while I'm not against any kind of augmentative system, I wouldn't start there. I would start with really focusing on spoken language as much as possible. Some woman reported on our toddler group last night. She signed up for my toddler course, I think 6 weeks ago. And she said her daughter had 2 words to start, and now she has over 500 words, which is amazing. That kind of progress. But I think parents and professionals give up on spoken language too quickly. Is it normal for children to regress more than once? A lot of people in my online courses are reporting regression because of lack of structure. And if you think about, if you go from a very active job to sitting at home in front of a computer, you're going to regress in terms of your physical stamina, your weight might go up, your endurance might go up. So regressing in different areas when you have little structure, during the COVID crisis, for instance, I think is happening all around us. It doesn't have to, but we then have to figure out how to, by downloading the 3-step guide, you can figure out, okay, 10-minute, 1-page assessment that's included in the guide. Okay, make a plan. And keep some easy data. Okay, I do want to take this off for a moment. Okay. My child is 3 and we are currently staying with my parents. My daughter loves her granddad a lot. She gets too excited and screams when he's playing with him, especially during this COVID lockdown as we're unable to go out anywhere. Being in home always has increased her emotions. We're trying to distract her. She's excited to keep her occupied always. Another concern is her waiting time. It's reduced now, and she's turned quite impulsive. Any suggestions to overcome these problems? Thank you so much. Your course is a lifesaver. Great. So you're in my course. So I would say we want to also teach the grandfather how to interact with her. So if you're in my course, then teach grandpa how to do the shoebox and potato head and how to deliver reinforcement. So he's probably delivering reinforcement. So if she were playing with me and she started screaming, I would actually kind of head down, whatever. And then once she's quiet, kind of look up and be like, tickle. And then, tickle. Or some kids can't really handle a lot of like tickling and wrestling and rough play. They get too, some kids with autism just get too overstimulated by that. So maybe training grandpa, have him watch some of the videos and train him on how to engage her in a very nice, calm manner. And the waiting time, if you think about how we wait as adults, if we're waiting in line at the grocery store, we're not just standing there waiting. We're thinking we might be planning dinner, we may be surfing Facebook, we may be, kids that wait need something to do while they wait. But we can, say she wants the phone and she wants to play with it. Okay, hold on. I have to check one more thing. Let's just count to 5. 1, 2, 3, 4, 5. Good waiting. Here's my phone. So that kind of waiting is where we would start, and then we would build up. How can I get my child to say 2 words? That's a great question. I think my carrier phrase video blog would be good to watch. We first have to get one word going, a lot of one words. And those one words can only be 1 or 2 syllables in length. So really look at the words your child is trying to say and the sound she's trying to say, he or she. And then we need to, once we get a lot of one words, in my courses I talk about 2-word pivotal phrases where we teach actions. I have a video blog on actions. And we teach colors. I have a video blog on how to teach colors. And then we put things together. So instead of I want candy, it's eventually blue candy. Or instead of I want ball, it's eventually kickball or throw ball or bounce ball. Or instead of open bottle versus open cabinet, instead of I want cabinet. So that's where the 2-word pivotal phrases come from. Is first we get the nouns of very reinforcing things. Then we put adjectives, adverbs, and verbs around it, make 2-word pivotal phrases, and get the child to the next level of language. But I'm not a big proponent on putting goals to increase length of utterance. I have a video blog called What's Wrong with the Goal for Timmy to Talk in 4-word phrases. And I basically say that if we talk about words, we could have refrigerator is 5 syllables, 1 word, and the cat ran down the hill, or ran fast is 5 words and 5 syllables. So we have to think about syllable length, not word length. And I learned that from Barbash, who's a speech and language pathologist and also a behavior analyst. Working on having students of ages 3 to 31 with practice with parents on the toleration of face covering. Yeah. So, I do have a video blog on how to desensitize to doctors, dentists, and haircuts, and I would use the same procedures. You could use video modeling. You can use, where you just have the child hold it up to their nose if they have imitation skills. And then if it's the looping problem, you can just loop 1, have them tolerate that. Same procedures for like desensitizing to headphones, but I'd take a look at the, and you can just search if you forget, just search Mary Barbera desensitization and you'll find some real good strategies for that. That's a great question. How many words, one word, should they be saying before two? I would say 100 at least. I would rather get 500. And I would rather get, 300 nouns and then, you know, 50 actions. And then, the more natural your child starts to put these words together, the better. But it has to be done systematically. Oh, my friend Hind is here. Welcome. Your program is the best in the autism world. Well, thank you. That's so nice. Kelsey said, I'm very impressed with you and your advice. Well, thank you. I've been at it for a very long time. And so I really do hope that if you're here live or watching the replay and you want to learn more about my step-by-step system, that you'll first take the quiz, marybarbera.com/quiz, and come into my world and learn my step-by-step systems, because I'm both a parent and professional. I'm an advocate. I'm a registered nurse. I have a PhD. I'm an author. I'm becoming another author of a second book. And I really do see a lot of problems and struggles in the autism world, both for parents and professionals. And I do feel, I don't have all the answers, certainly, but I feel like I do have a very unique, child-friendly approach that works. Okay, so let me just check on my Facebook and see if I have... Sometimes on my computer, I can only see a few comments and I can't see everything. So let me just check on here and see what kind of comments I can see. And okay. Can you have mild to moderate autism? I haven't heard you mention it before. Yeah, you can have mild autism, you can have moderate autism, you can have moderate severe autism. So back when Lucas was diagnosed with autism in 1999, they were using the DSM-4, the diagnostic codes for that. And back then, autism was thought to be 1 in 500. And back then, there was things like PDD-NOS, which is pervasive developmental disorder not otherwise specified, which is a very mild form of autism. There was also Asperger's syndrome, and then there was autistic disorder. So he got, within a month or two, he got PDD-NOS and he got moderate to severe autism. So you can't predict how a 2-year-old's gonna do. So I've seen kids with my own eyes with moderate to severe autism diagnosis who've, been mainstream, been fully conversational, been bilingual. I've seen kids with mild autism when they were little. Actually, my son Lucas looked really much more typical than he does now. When he was 2, he looked really good. And another boy started at the same time with the same consultant, and he looked really impaired, and he went to college and drove, and Lucas is very impaired. So what I say is, don't rest on your laurels. Don't try to go like, oh, it's only mild autism. There's no such thing. You treat it like, it's like saying, well, I only have this cancer, and if I had that cancer, it'd be much worse. Maybe on paper, but cancer is life-changing, and cancer is a something you want to avoid, something you want to reverse, something you want to, have the least impact to your life from. So you don't want to rest on your laurels and go, it's just a little touch of autism. You want to treat it like it's like the most aggressive form of autism you've ever seen. And yeah, that's my advice. And that's in my book in chapter 12. I got that advice very early on when I thought Lucas just had a speech delay and then just had PDD-NOS. And part of why I think he has moderate to severe autism is because I waited a year and a half to really aggressively treat him. Okay. Okay, so Kelsey is waiting for a diagnosis. Really encourage you, if you're not in my online course, that's the best place for you to be. People are literally making tons of progress with their 1 to 4, 1 to 5-year-old kids in there. And many, probably half of them, do not have a diagnosis of autism yet. They're waiting, they're worrying, and some people are actually avoiding the diagnosis. Okay, so I cannot, if you asked a question on Facebook earlier, let me know and in the comments again, because I'm losing your questions. How do I get my child to be more conversational? Yeah, so that's really the verbal behavior bundle course that I offer. It's all VB-MAP level 1, 2, and 3. And if you have a VB-MAP level 1 and 2, you are definitely not conversational. And working on those level 3 skills is really tricky, even trickier than working with someone who's not talking. So it is, you can search Mary Autism Conversational, and I have done some free blogs, but it is quite complicated. Is there some kind of medication that should be taking to calm them down? My son is on a medication that has literally changed his life, but it is a cardiac med to calm his nervous system down. And I talk all about it with Lucas's psychiatrist, who is also an autism dad, Dr. Michael Murray at Hershey. Talk all to him as one of my favorite podcasts. It's episode number 28. So marybarbera.com/28 is an excellent episode on medication use in kids with autism. I've also done some video blogs on medications and how to teach kids to tell you they're in pain and everything. So just search around Mary Autism, whatever your topic is, stimming, scripting, medication, how to teach pain, desensitization, and you will find a lot of resources. Anna is here. Anna found my course when her son was 8 years old. And she bought my course as a birthday present for herself, and has been a really nice journey. It's been, I think, 5 years since Anna's joined my course and community, and she's given me permission to share her videos and pictures and name and everything. So, yeah, it's been great. Okay. Okay, let's see. Should I stop my nonverbal child from rewatching the same TV clips over and over again? He has specific targeted apps from his iPad, but will always find the iPlayer and the same programs and then replay them. He's doing this more with increased screen time and will only watch limited programs. I'm not sure how old the child is, but like I said earlier in the broadcast, increased screen time during the COVID shutdown is very common. I actually, there are ways to turn off certain things, put it on parental controls, the iPad, turn off the Wi-Fi. And the other thing, I'm doing an interview. Tomorrow's podcast is going to be with Kate from Finding Cooper's Voice. And I end my interviews with, tell me some stress reduction tips. And Kate taught me something that literally has improved my life. And you'll hear about it tomorrow. But her thing was finding a volume control app for Lucas's iPad. And so he literally cannot turn it up. And even though he has headphones on, he would turn it up and they would get overstimulated. So even just downloading that, I think it was $5, downloading that volume control app was awesome. Teaching kids to tolerate, but I would recommend that you do not let this, for hours a day or minutes a day, that you have a lot more control over the devices. And the best way to do that is by joining my courses and community, because what happens is, you listening here, so that's awesome. and I know people are not always in the financial situation where they can join my online coursing community, and that's one of the reasons I'm producing so much free content out there. But I really think that you should consider joining and really getting a handle on it. You can watch my free video blogs, like I said, on screen time and how to teach your child to talk and use the shoebox program and stuff. But unless you're really working on it systematically, you might try to do this and then this goes. It's like a whack-a-mole. And unless you're really assessing that free guide, the 3-step guide is I think an excellent start. It'll teach you very quickly how to assess within 10 minutes, how to make a simple plan, and then how to keep some data. So that might be a really good start. But, I hesitate to be answering questions that are just hodgepodge, because within each child is their unique strengths and needs. That's where this guide really will help you, hopefully. Okay, we're getting to the top of the hour. Post-high school age, no college, no job, diagnosed with anxiety and Asperger's, just stuck now. Would this be considered somewhat normal? Yeah, I've heard that like 85% of adults with autism are either unemployed or underemployed. This is before COVID. And, while I said back in 1999, there was, Asperger's and PDD-NOS, and, now today they've gotten rid of that because it's the DSM-5, and the diagnostic code is just autism spectrum disorder. And so, people, then there's level 1, level 2, and level 3. But you don't have to think like, my child has severe autism, I'm stuck with this, he's stuck being right here for the rest of his life. There's movement. And a lot of that movement is dependent on parent intervention and parent learning. Jamie is in the house. She's one of our members who has posted that she is spending COVID time on potty training, which is an excellent idea. What do you think of supplements for autism? I don't talk about supplements a ton, but I'm a registered nurse. I'm a mom, and I'm also a behavior analyst. So in my courses, I don't talk about supplements much, because I don't want it to be like, oh, I heard of this therapy, or did anybody try this supplement? Like, that's not what we're about. We're about learning my approach, implementing it, applying it, coming back to the group when we're having problems implementing, because I don't want to junk up my group with a bunch of things. But I did do a video blog on medications and supplements, and talked about my podcast. After Kate's podcast coming out tomorrow will be with Dr. Missy Olive, and we're going to talk about the gut-brain connection. We're going to talk about supplements, but I did do a video blog on medications and supplements you can check out. So I'm not against it, but you have to be careful, because even if you hear supplements, you think that's like always, well, some people would be like, that's always bad, and that's not regulated, and that's going to cause problems. And then they think medications, that must be good, that's formal, that's studied. But I've found problems with both. Like, one time I gave Lucas a multivitamin when he was little, and he'd get agitated within 20 minutes. And then I found out that the multivitamin had copper in it, and that kids with autism had messed up zinc to copper ratios, and that he actually needed zinc supplementation. And he's been on probably 12 traditional medications over the years, and they've all been a disaster until we found this cardiac med that has been a godsend. So I am open to medications and supplements. You just have to be really, really smart about it. My 18-month-old just showing signs, and I'm thinking of joining. What's the best to get her to respond to her name? Yeah. That's a great, I do have a video blog on that. So basically, in a nutshell, it is you stop using her name in general. Like, stop. I remember my first consultant came to implement ABA, and Lucas was just 3, and it was a big like workshop. My husband was there, I was there, the 3 therapists that were going to be working, my parents, like everybody was there to learn from this woman, and Lucas was there. And we were like, she's like, can he touch his head or whatever? And we were like, Lucas, touch your head. Lucas, stop. Lucas. And she's like, okay, everybody stop using his name. Because, he's the only child in the room, especially if you're saying no or stop or placing a demand, like, Lucas, get your shoes on. It's increasing your length of utterance. So just stop using his name. So that's number 1. Stop using the name. And then when she's playing with something or stimming with something, come up behind her, say her name, tap her, and deliver reinforcement. So whenever you're delivering reinforcement, like you're blowing bubbles, so you could say bubble, bubble, and then she looks up and so let's just I'm not sure if you have a girl or boy. Okay, let's just say her name is Amy. And then she looks up and you're like, Amy, mommy's going to blow bubbles. Or you're pushing her on the swing. Push, Amy. 1, 2, 3. So when she's having fun, that's when you're going to use her name. And then we have a specific system, which I go over in the blog, to fade out those prompts and to get her to responding to her name. So the number 1 thing is stop using her name so much. And number 2, only use her name when you're delivering reinforcement. That'll start pairing up her name to be exciting. Okay, Nora says she signed up for the course and is working through it very slowly as I'm juggling lots of things at the moment. Yes, totally get it. And Nora said, thank you, Mary. Yes, the volume app will be a lifesaver. We are constantly turning it down. Then he turns it straight back up. Yeah. And he does the same thing with his CD player. So I took a piece of clear packing tape and put that over. But only after Kate suggested the volume reduction app. I'm like, oh my God. Like, I've been dealing with this, and I'm a behavior analyst, and I haven't even thought of that. And it was been so nice. So anxious for that little tip to get out. So yeah, so I think I got to a lot of questions today. I don't know about all of the questions. All right, let me just see if there's anything outstanding. Tips on head banging. I mean, head banging is can be a very serious problem behavior. So, he may need immediate attention. If he's banging his head on hard surfaces, could cause a concussion, skull injury. I had a client once who would bang his head on hard and soft surfaces so much that he had an open lesion on his head when I started at the age of 2. And so we just systematically started calculating when he was banging. Oh, he's banging on the high chair. Okay, we got rid of the high chair. We used a booster seat so he couldn't bang. Put a pillow behind his head. He was taking 2 naps, but he was banging before the nap, after he woke up. So now we went down to 1 nap and no banging. So like if it's minor head banging, it's not causing a concussion, that sort of thing. You can definitely put antecedent manipulations in place, but if he's head banging, he's probably also not talking or not talking well. He probably also has feeding problems, sleeping problems, and all kinds of issues. And that's really the only way I can really help you best is through systematic procedures in my courses. And you might, on top of that, if the head banging is severe, need more systematic help as well, individualized at home. Because one thing in our online courses and community is we don't look at your videos. We don't really help you program or help you because I could tell you one thing and I don't know half the story about the head banging, or in this case, I don't know 99% of the story. Um, so ethically and legally, I can't answer specific questions like that. But what we do within our online course and communities is we teach you how to analyze. We teach you when we absolutely need to get to a doctor or a hospital, and when you can work more slowly on changing things. My son's just started shaking his head yes and no to questions I ask. He still doesn't verbally say it, but it's a start. Thank you so much for all of the work you do. Excellent. I do have a video blog on teaching yes and no, which is a really important skill. So anything I said I covered today, whether you are live or watching the replay, you can always search Mary Autism plus the topic or your struggle, and you probably will find a free video blog or podcast. So we are at the past the top of the hour, so I am going to say goodbye for today. Thank you all for joining me, and if you're watching the replay and you have a comment or question, feel free to put them in the comments, or join me here live next week, same time, same place, 1 p.m. Eastern Time, every Monday for an autism live call with me. So thanks again for joining me, and I will see you next time.